Hi there. Today I'm going to walk you through a telehealth physical therapy appointment with NJ Homespine. I'm going to talk about what you can expect before the appointment, during the actual appointment itself, and then what will happen afterwards. All right, so let's go ahead and take a look. Firstly, I'd like to give you a quick outline of what you can expect during the visit. First will be an introduction and an interview process where I kind of get to know you and your case a little bit. Second will be a mechanical evaluation and analysis where I'll ask you to move your body. I'll observe through the video chat and I will ask you to report how you're doing with those movements. After that, we will try some interventions, which will be repeated movements or postures, which will be used to help you recover from your situation, from your condition. The next step is a discussion and a review of what you had experienced during the visit and what all this information means. It's kind of like an educational session, but it's also a discussion. I'm going to encourage you to ask lots of questions during that time. The fifth aspect and the final part is the follow-up. After we're done with the visit and we've said our goodbyes, I will follow up with you via email, text, or a phone call, whatever is preferred for you, and we'll discuss how you're doing, how much progress you're making or not making, little adjustments that can be made. You can again ask any questions that you'd like, and if it's really needed and important, we can schedule a follow-up visit. Okay, let's go into a little bit more depth with each step. The first section is the introduction and interview. During this process, I will review some of your medical history with you just to get a better idea of it. You will receive a form beforehand to fill out, and that will give me a much better idea and I can be more prepared for the visit. We'll discuss some of those aspects, but then I'll also ask you about your current episode of pain or limitation, whatever you're experiencing. So that'll be like, what type of symptoms you're having. Is it pain? Is it discomfort? Is it weakness? Where are those symptoms located? How long has it been? Are you getting better? Or are you getting worse? Is it staying the same? All sorts of questions like that. It just gives me a better idea and also helps you to confirm with yourself, just to kind of be a little introspective and understand what you're going through a little bit better. After I've kind of established a nice baseline information, if you will, that's based on your medical history and what you're telling me at the moment, then we'll move on to the next section. The next section is the mechanical analysis. During the mechanical analysis, I will ask you to move in very specific ways which are related to your condition. So if you report that you have like a lower back problem, I will ask you to move your lower back region within view of the camera. That will probably be done in standing, but probably also be done lying down. So if you can set up either whatever camera you have or whatever device you have in a position so that I can see what you're doing, that would be the best case scenario. It doesn't have to be too intricate. You don't need to buy expensive equipment for this. It's just put it in a position that it will hold, and then I can see you move a certain way. I'll ask you questions about that. And of course, don't worry. I'm going to demonstrate every movement I expect you to perform. And if anything feels too uncomfortable or starts to cause pain, you will be instructed to stop immediately. Okay? After we have gone through a few movements, I may ask you to move some additional areas of the body. Oftentimes with a lower back problem, your hip joints may be involved, and I may ask you to move your hips in certain ways too. So I may demonstrate bringing your leg up into flexion or maybe going into a lunge position if that's appropriate, because that allows your leg to go backwards. It depends on which part of the body that we're looking at and what we're talking about. I like to be very thorough with this because the more information I have, the more likely I am to give you a successful strategy. Which brings us to our next part, which is the intervention. So after we have gone through that mechanical analysis and I understand more about your limitations and the behaviors of your joints and the pain problem, I will test some strategies, some movements, and we will repeat them over time. The repeated movement segment is very important because this is our discovery process of figuring out what is the best movement, what is the best exercise, if you will, for you to perform that's going to allow you to succeed. So during that third section, we're going to go through that. We'll try some repeated movements and we will find the movement that works best for you. Once we are done with the repeated movement segment, we will move on to the summary, the wrap-up, and the discussion. This is my opportunity to educate you about what you're experiencing, why certain movements worked and which ones did not work. And it's also an opportunity for you to ask questions about that same thing. It's in my best interest, but also in your best interest for you to understand your condition in the most comprehensive manner possible. This is going to lead to the best outcome or prognosis. So we'll talk about it. We'll try to understand some things so that you understand what you're dealing with and you will make better decisions about managing your own case when I'm not in direct contact with you. Maybe a few hours later, or maybe over the course of a few days, you'll start to come up with some better questions for me because now you understand your condition better. That follow-up communication will be very important. That is the fifth step. I will send you, once our visit is done, a summary of findings document which explains what we found. It'll be stuff that we've discussed already, but it's just going to be in writing so you can remember it. And I will also send you a home exercise program, or HEP. This is that specific movement that we found helped you, and I will have pictures of exactly that movement, how often you should be performing it, how many you should be performing in a set, and how to manage it. So once you get to that follow-up stage, we'll communicate and discuss a little bit about what's going on. And again, if deemed necessary, we will then move on to another appointment if you really need it. And I'll suggest when that should be and all that sort of thing. So you can see that there's 5 stages or steps when you book a telehealth physical therapy appointment. And those 5 steps will walk you through a very organized and specific process which leads to success for most patients. I hope that this information has been very useful, has been very helpful for you. I hope it's made you more at ease with this process and understanding what a telehealth physical therapy appointment entails. And I hope that you have a great day and that you're doing well. Thank you very much. Take care.